My name is Carol Curtis, and I am one of the social workers here at PACE. Our duties as a social worker are to support our participants and our families. And we also coordinate resources, that our families may need. We assist them with that, and we're always available to, coordinate anything that they might need other than, the medical needs. What is, when you're at the end of life, but it's end of life. It's living. It's still life, and that's what we try to get everybody to be as full of life as they can. Quality of life, that's what matters. We have those that are cognitively alert and functional, but they have signed a DNR. But they wish that when it comes time, if my heart stops or if I stop breathing, let me die naturally. So allow natural death.
And you guys really, are you rolling? Yep. Okay.
Well, I'm Dr. Sharon Pettigene, and I am the medical director here at Riverside PACE program. A lot of primary care physicians are not versed in them, so they'll send off, say they're dementia patients, they'll send them off to the neurologist, or they'll send them off to a geriatric center because they're not comfortable enough with their training to do that. So they kind of shelf them all out. And then I think probably one of the biggest things in geriatric medicine is exactly what you hit on, is that here we get to know more about people than ever. I mean, we know just about everything that's going on in their lives currently. And that allows us better rapport with the families, and it allows us to deliver appropriate care. For instance, it's sort of a knee-jerk reaction. If I were out in the community and somebody came in my office and I suspected a hip fracture, I'd ship them off to the hospital. I just wouldn't have the capacity to do anything. And actually this week alone we had a lady that came in. She's not going to benefit from surgery. She's not going to benefit from going to the hospital. She's not going to benefit from being in a nursing home. Her son wants her home and wants the help to do that. And so consequently, we brought her here, diagnosed it, got basically a phone consultation, and was able with help to send her home so she can live out the goals of her life, which would be dignity and comfort. So she doesn't have to go through this poking and prodding, because everybody goes to the hospital is going to have some kind of IV, catheter, etc. And those are kind of the advantages, I think, of having holistic care. You get to know where they are. You really get to know whether or not she's a candidate for all these interventions, or really that's just a waste of time to make her more miserable. When you get to a certain stage in your life where you can't fix a lot of stuff, you're kind of left like a river with a fork there. One side has a nice, smooth, easy way to get to the end, and the other side is full of rapids and drop-offs and waterfalls and things like that. If you're young and you have a lot of things that can be corrected, it might be worthwhile to take that turbulent path, to really fight and do everything. But if you don't, why do you want to put someone through that misery of doing all that? And I believe very strongly in quality of life. And most people, if you really talk to them in their right mind, that's what they value. They will often say, well, if I can't do this or I can't do that, or I'm going to be a burden to my children, I would rather not be around. You can just let me go naturally. Of course, nobody wants to suffer, and that's kind of what you hit on. I mean, you're right. In medicine, sometimes we're so focused on doing all the stuff, and I have to say, a lot of times it's an easier way out than sitting down and having some really heart-to-heart talks with families. Those are really difficult to do, and sometimes families aren't ready to hear it. They think somebody ought to fight to the last breath just because they're afraid of that separation.